Okay, so this is the second video. This is the second video finishing up cardiac cath lab, cardiac catheterization. And we're talking about, of course, we're going to be doing our nursing interventions post-procedure. But let's talk about some of the things that can go wrong besides the risks that we talked about and how would we deal with those. So patients can get a hematoma afterwards. These are very extensive hematomas. You can see the groin puncture on this right-hand sided one where the patient originally had a hematoma. They marked it and then it got worse and spread out all through here. The best thing to do is, again, we teach our patients about signs and symptoms. We let them know if they tell them to let us know if they're experiencing any swelling or discomfort in the groin or they feel any wetness down there. If we're doing our groin checks as often as we should be, hopefully we can also catch it earlier. And what we would do is we would, if they're experiencing a hematoma, it's rapidly filling because it's being supplied with blood from an artery. So we would apply pressure and call the physician about applying a pressure dressing or a sandbag, just depending on your physician and how they like to deal with that. Sometimes if there's a small hematoma, they like to mush it out, and patients can expect to have a very tiny hematoma at the site afterwards, like maybe a size of a quarter, but no bigger than that. One of the most important things that I want to talk to you about, though, in regards to that, is we don't take off the dressing. So even when it's bleeding, we hold pressure above. If it's saturated and and the tegaderm has come off because it's saturated and we still have an active bleed, then you can take it off. But otherwise, we just reinforce, because think about if a blood clot has started to form underneath with that bandage on, we remove the dressing and then we're going to disrupt the blood clot. So usually you leave the dressing on for at least 24 hours, unless, like I said, it's super saturated and already slick with blood. Then you would take it off and reapply a new dressing after cleaning them up. So this is a complication that can happen. This guy had a really bad one. You can see it got all down into his pubic area and into his male genitalia area. So it's very painful and unpleasant. This one's a very fresh one, and this one obviously is starting to heal. We can see with the yellow. So that's one possible complication. Another possible complication is a retroperitoneal bleed. So what we're looking at here is, so the puncture site, remember, you might be seeing it up here on their skin, but the actual puncture site of the femoral artery is here. And a retro bleed, remember, retro means going backwards. So artery flow is this way. And a back bleed, or a retro bleed, means bleeding back this way. So instead of bleeding forward and us seeing a hematoma forming here, it bleeds backwards into the abdomen and into the abdominal cavity. So this is a CT scan, and if you were to go through a normal person's CT scan, just above this we would have seen the kidneys, and then we would be seeing bowel, not this. This is all blood in a retroperitoneal bleed. So if you ask the patient with your groin checks about back pain, and to report any abnormal or new pain, and the back pain might be the only sign and symptom that they have of this. Late signs will include positive Cullen sign and Turner sign, so blood around the umbilicus and blood on the back and the flank. And this was another thing that I got to see as a student, was actually a patient that had survived a retroperitoneal bleed. And this is the beauty of getting to be specialized in a unit, because if you know what to watch for every single time, then you will be more likely to catch things that are going wrong with the patient. So we got that. Here we go. Here's the cell dingers. So bleeding can be a complication. So this is what it looks like here, going through the epidermis and the subcutaneous layer down into the artery. They put a needle in there, and they make sure that they catch the blood in a syringe. And you're going to see this if you watch the video link about the cardiac catheterization. So this is how they gain access into there. They might need to make a little puncture so that they can get the sheath down in there, like that, and then this is the wire that they can thread up through the artery. But when they take this out, this is why you hold pressure an inch above the site, or 2 centimeters, because that's approximately the distance, because they go in at a 45-degree angle. The distance from the top of the epithelial layer, the epidermis down into the actual artery. So I can't remember what this is of. Oh, this is an older article, but it's a great resource just talking about a lot of the complications that happen intra-procedure for a cardiac cath. So something for you to check out. But out of all the videos that you can watch, I would highly recommend you watch the actual cardiac cath, because not every one of you get to see that procedure, so it'd be interesting to watch it. So that is cardiac catheterization, video 2 of 2.